Hello, I'm Nurse and the owner of Florida Training Academy. In today's video, I'm going to be showing you how to brush the teeth of someone who is in the bed. I have all of my supplies here, which will include a towel that we'll use as a clothing protector. I have the toothpaste and toothbrush. Of course, I have clean hands with gloves on them. I have the emesis basin, a cup of water, and I'm going to go ahead and start the skill. You want to be mindful of safety, and so in order to prevent our patient from aspirating, what position do we need to put our patient in before we put water in his or her mouth? And if you said upright 90 degrees, that's perfectly correct. The Fowler's position can go from 60 degrees all the way up to 90. I just feel more comfortable raising my patient up as far as they can tolerate. So I'm going to go ahead and raise our patient. Are you doing okay today? If you feel like you need to reposition, you can go ahead and do so. I'm going to put a towel over your chest. Would you like a sip of water before we start?
No, thank you.
I'm going to wet the bristles of the brush. Apply a small amount of toothpaste. And this one is mint. Are you okay with mint?
Mm-hmm.
And now we're going to perform the skill. Okay. So with my clean gloves, I'm going to go ahead and open up your mouth. All right. We're going to start off with the front teeth. I'm going to go inside. I'm going to repeat that process up top. And now that I've brushed all, and if you go ahead and clench your teeth together for me. All right, and so now that I've brushed all the surfaces, if you'll stick out your tongue, I'm going to brush your tongue. I'm going to now give you some water so that you can gargle. Good, and we'll let you rinse one more time, and I'll make sure I clean your beard. Very good. Clean your mouth and your beard. So now that I'm done with the brushing of the teeth, I'm going to throw away my disposable supplies. After emptying the contents of my emesis basin into the toilet, I would have to use a napkin in order to turn the water on because my gloved hands cannot contaminate the sink or the faucet handles. So I would rinse, pour out my rinse water, and then I would dry the inside of the emesis basin. Of course, I would store whatever supplies I have left. Don't forget to take off your gloves, wash your hands, reposition your patient, put that side rail back up, and make sure that he has his call bell in his hand before you leave. And then also remove the protective covering. All right, everybody, this is Eunice Mathis for Florida Training Academy. We wish you the best of luck with your future CNA examination, and we hope that this skill will help you to pass your test and also provide better care for your residents.